Guys, and welcome back to my channel. If you are new here, my name is Corinne. I've been vlogging my nursing journey as well as my life as a single mom with a special needs toddler. And if you've been following me for some time, you guys know I got acclimated to the OR as a brand new nurse. This was late December, early January of this year, and then COVID happened. I had to take a break. We were furloughed and I was working frontline. Now I am back working in the OR. So I'm going to be talking about what my job entails, pretty much break down what happens in the day and what I do. So yeah, definitely stay tuned if you guys are interested. This will be a series. Hit that notification bell if you haven't, and if you are not subscribed, hit that subscribe button right now. Now, for those of you who are interested in working in dermatology, plastic surgery may be an option for you, but I do want to acknowledge that working in plastic surgery is not as glamorous as people may make it seem and what you see on TV. Now, I do work in a clinic setting where we specialize in lipo and other body contour procedures, but I do want to say at the end of the day, I do come home dirty. I have a heavy day and I split up my day between clinic and the OR. So I'm going to start off talking about clinic. And in clinic, this is when I do consultations, pre-ops, as well as post-ops. Now with consultations, these are called meet and greets. This is when we're meeting the patient for the first time. They're meeting us, myself, the nurse, as well as the plastic surgeon. So this is a time that the patient has a chance to ask questions about the procedure. The surgeon gets a feel for the patient, see if they're a good candidate for the procedure that they're interested in. And this is the time that I get to talk to the patient about the procedure and what I'll be doing, as well as possibly sell other options. Now, the second half of clinic, I do pre-ops. So this is when the patient actually confirms that they're doing surgery. This is of course after the surgeon agrees to do the surgery. They already have their financials set up and we're going to the next step. Now we have a date for surgery, but before surgery we need to do an assessment. The patient comes in to get the initial assessment done. This is a physical assessment. We also get medical clearance if there is needed. We're just making sure that the patient is healthy and gets approval to get the surgery done. Now while we're doing the pre-ops, we're taking photos, we're getting the max on the patient. This is based on their weight. There's only but so much local that we can inject in a patient to get the surgery done safely. We also give them instructions for the surgery, just reminding them take their medications if they have any blood pressure medications, if they have sleep apnea, that they have a CPAP machine, whatever is needed for the surgery. We just advise them, listen, you have to have this or the surgery can't be done. And this is also when I get the patient sizing so that way they can get a garment, because once they're done with surgery they get sent home in a compression garment, and then they also get a second garment sent to them. And yeah, that's pretty much it. Now the third part of clinic is post-ops. Now I'm jumping a little bit of ahead. Of course, I'm going to talk about surgery in a little bit, but this is usually a week later. A patient comes back after surgery. We do the assessment, making sure that they are okay overall, that they haven't experienced any complications, making sure that they have taken their medication, especially an antibiotic. It's very rare that a patient comes back with complications, but it does happen. A patient may forget post-op care. They may not be aware of the fact that they need to take care of the incisions and stay dry, stay clean. So we pretty much re-educate them on everything, making sure that they are wearing the compression garment. Now the patient also comes back very swollen. That happens after surgery, and they usually feel bigger than what they were when they went into surgery. It happens. We just have to explain to them that it's a whole process. It does take time, and the patient will come back in a month, then 3 months, and then 6 months. Now in some instances, I will talk about this more into detail in a separate video. Patients may come back and they may not feel satisfied with the procedure, and if there's any request for a revision, the surgeon will come in and assess the patient and determine whether or not they need to go back and redo the surgery. So it's a whole process, but usually those appointments, they go really quick. And that was a mouthful. So now I'm going to talk about my surgery days, which are my heaviest days. Now me, I like to look at my schedule a day ahead just so I get a feel of what type of procedures I'm going to be scrubbed in on. Usually we have 3 cases in a day, and each surgery can range anywhere from 2 to 4 hours depending on what is getting done. Now in surgery, it's usually myself, another tech, or another nurse. One of us are scrubbed in while the other one is circulating. Now sometimes it's just me and the surgeon. But in this case, a surgeon may be working independently where I don't have to scrub in and I'm just circulating the OR. Now, before I go into detail about what happens during procedure in the OR, I'm going to break everything down from start to finish. Now, when a patient comes in the day of procedure, I usually launch my own patients. So the patient comes in, they get undressed, I take their vitals, I make sure that they are within range for the procedure to get done. The surgeon comes in, they give me the okay to give their medication. They also do their markings. So this is pretty much markings for the added sites where they make their incisions, and I'll also prep and clean the patient for the surgery. So I'll bring the patient into the OR, get them cleaned, and I'm usually just cleaning the areas and around the areas where are marked so that way they can get the local anesthesia. Now, once the patient is in the OR, making sure that the bed is warm, making sure that the patient is comfortable. Usually I'll do a timeout, and this is just confirming that the patient is getting the areas that we agreed upon, also making sure that all the instruments and everything in the room is set up. And also, this is an agreement with the surgeon, so he just gives the okay, and once the surgeon gives the okay, then we get started on the procedure. Now, once the procedure starts, this is game time. You are the eyes and ears of the OR, and I like to call myself the ninja of the OR because literally I hop over cords, I'm passing instruments, I'm monitoring the patient, I'm updating the board, I'm updating my surgical note, I'm in an autoclave. There's just so much involved, and this is what I'm saying. You really have to be able to prioritize, be able to time manage, juggle a number of things, and pay attention to detail. So as I'm being attentive to the surgeon, I'm also being attentive to the patient. I'm making sure that the vitals are within range. If there's any change in status, I notify the surgeon right away. Sometimes I have to do a safety timeout and grab medication. It's very rare that things happen like that, but you really have to pay attention because sometimes the surgeon is so caught up in what they're doing, which is understandable. And usually I'm scrubbed in on the surgery, so obviously I will have a tech or another nurse that's circulating and monitoring the patient, updating the board, and doing things outside of the sterile field that I can't. Now, aside from working in the OR, you also want to pay attention to the instruments, and we do autoclave our instruments, pretty much sterilizing the instruments after the case, or sometimes instruments actually drop. So if an instrument does drop, I go to the autoclave and I sterilize the instrument. Now, usually we are not out of instruments. We have enough for all 3 cases, but things happen, instruments get broken. So again, you have to pay attention to what is going on. Sometimes the surgeon will not even realize that a cannula dropped, so you want to pick up the cannula and sterilize it just in case that the surgeon needs it. Also, you want to be mindful of the sharps and other materials that are being used during the procedure because you have to keep count of everything that's going on. Now, once the procedure is done, the patient is going into recovery, and this is when I take the last vitals, making sure that the patient is okay. I get them cleaned up, I get their patches on, their gauze, whatever I have to do to make sure that they're not draining everywhere. I also get them into a compression garment. At the same time, there may be a drain depending on the procedure that was done, so I instruct the patient on how to take care of the drain. Now, usually since the patient is medicated, most of them are drowsy, they're not going to understand what's going on, so their caretaker or their loved one, whoever is picking the patient up, I go over discharge instructions with them, making sure that they take care of the patient, that the patient is well aware once they're back to their normal self on what to do. So now that your patient is gone, the case is done, you have to flip the room as well as autoclave. So flipping the room is essentially cleaning up the OR. Just be mindful, you're working with sharps, you're working with instruments, and you're working with body fluid. If this scares you, the OR is not for you. It's going to be a little gory depending on who you're working with. Sometimes you have a surgeon that is clean, doesn't throw instruments everywhere, but then you have those surgeons that just don't care. They fling stuff everywhere, and you just have to be mindful. As you get acclimated to the procedures, you'll get to know what instruments you're working with, so you'll know what to look out for. Also, depending on the procedure that I'm working with, sometimes there are specimens, so I make sure that I bag everything up and I dispose it properly. Also, taking the instruments, you want to make sure that you keep count of the instruments that were used and set out on the table, that those same instruments go back into the autoclave to be sterilized. Usually I have somebody that's working alongside me, but most of the time I'm actually working independently, so I do flip the rooms by myself. And once you get acclimated, you start to find your flow, you start to find your routine, so then you'll get quick once you're flipping rooms. And sometimes they'll move you up in a case, so you may be working the first case. If they find that you're quick, they'll have you flip the room for the second case. And usually when I do flip a room, I like to prep for the next case. This is just common courtesy for the next nurse or next tech. So yeah guys, that's pretty much what I do in a day while I'm working in plastic surgery at my facility. If you guys are interested in the pros and cons video, I'm definitely going to make that video next. If you're interested in getting any plastic surgery done, definitely leave a comment below. Hope you guys enjoyed this video, and I will see you guys in the next one. Hit that subscribe button. Love you guys. Bye.